Alright guys, what is up? So today we're going to be talking about a percutaneous coronary intervention. So if you guys have a cardiac exam coming up for nursing school, make sure to watch this video. So a percutaneous coronary intervention can also be called a cardiac catheterization. It can also be called an angiogram. These can be used interchangeably. It's basically when the patient's coronary arteries are blocked, so the doctor has to go in there and open it up with a stent so that blood can reperfuse. Um, us as nurses, we will tell our patients, we will ask them, are you guys allergic to iodine or shellfish? The reason why, guys, is because that contrast dye that we inject into the patient to be able to see where that blockage is, it can also contain iodine. Therefore, if the patient's allergic to iodine or shellfish, we probably won't give the contrast dye to prevent that risk of an allergic reaction. Pre-op, guys, we tell our patients to drink plenty of water because the contrast dye is not friendly to the kidneys. It can cause something called contrast-induced nephropathy. That's basically when the kidneys take a hit from the contrast dye. Therefore, we will tell our patients, drink a lot of water before you guys have this procedure so that you can flush out that contrast dye to mitigate the risk of kidney damage. Specifically, guys, are diabetic patients. Diabetic patients are already at risk of kidney damage. Therefore, you really have to stress to them, drink a lot of water to flush out that contrast dye as soon as possible. NSAIDs, heparin, warfarin, enoxaparin, guys, these are all blood thinners. As nurses, we will tell our patients, I need you to stop those blood thinners a few days to a week before the cardiac catheterization, because if you puncture the artery, guys, it's a bleeding risk, and we definitely don't want our patients to bleed out. Guys, I've seen on the exam they use naproxen, they use ibuprofen, and sometimes I've even seen ketorolac in nursing school on the NCLEX and on the HESI. I've never seen them say the patient's on NSAIDs. They will use specific terms, guys. So they really love using naproxen, ibuprofen, ketorolac sometimes. So make sure to watch out for those. Guys, post-op, monitor the puncture site to make sure the patient's not bleeding. Monitor creatinine levels, guys. Normal creatinine is 0.6 to 1.2. If that creatinine starts going up, maybe 1.5, 2.2, 2.5, guys, the patient's kidneys are taking a hit. Therefore, we got to let the doctor know and potentially give the patient a bolus of fluids to be able to flush out more of that contrast dye. The patient is going to lay supine, guys. That means flat on their back for 4 to 6 hours to let that puncture site heal, guys. That means the patient's not going to sit up 90 degrees in their bed. That means the patient's not going to bend at the hip.